So HSCRP is the biomarker for that, measure that. And then, of course, if you're having symptoms, bloating, diarrhea, constipation, definitely need to go get that checked out.
Yeah, it can be so easy to just kind of feel embarrassed about it or be negligent of it or to just kind of brush it off to the side. But
I can't tell you the number of like men and women that I see that are like, don't want to talk about it because they're just like, doctor, like I have a lot of gas. And they're so embarrassed about it. But it's like, let's double click on that. We need to figure that out, right?
Yeah. And it's almost like it's weird what we've been taught to like be ashamed of in society when these are like really normal, natural things that we all need to be massively aware of. It's interesting how the most important things in society become the most taboo to talk about. We're talking about health right now. Money's another one in a different way, or like even like relationship challenges or things that are vulnerable have become this thing of like, don't talk about it. It's weird.
Yeah,
it's strange.
It's sad, right?
Yeah, it's really sad. Yeah, it's really sad. Like, so.
Well, hopefully, stuff like this podcast, you bring it to light, people start talking about it, and bringing it more into mainstream conversation is so important.
Yeah, I think that's what's needed. I know for a long time, like, I didn't know who to talk to about things because you just don't hear it.
Right.
And I think when people are talking to their doctors, also having physicians who we feel understand this language. And that's why I think with you saying that we need to become the CEO of our own health, I think we've always wanted to outsource it to a doctor or to a healthcare professional, whatever it may be. And the truth is, no one's going to care about it as much as you.
Absolutely.
And so it has to start there. So I want to focus on this one because it's so interesting. So you obviously talk about heart health as one part of your wellness wheel.
Mm-hmm.
And it fascinates me because even when I've seen it on your wellness wheel a million times when I've been in, and when we know how important the heart is, we rarely talk about heart health. And if we do, we kind of do it in a soft way. We don't really talk about it from a scientific point of view. And you talk about how important it is to know our levels at 25 years old. Is it APOB?
Yep, APOB, right.
Yeah.
Mm-hmm.
So walk us through that and understanding what that is, what it means, and how do we know?
Right, exactly. So I think everyone's heard about like watching your cholesterol levels, right? Okay, so right now what happens is you get your cholesterol levels measured sometimes in your 30s if you're lucky. Usually doctor will wait till you're 40. And unless it's like over a really high number, no one's really going to do anything about it.